I just wanted to do a quick video on the name change of a condition that affects a lot of women and certainly has fertility implications, but is actually a lot more. So from really May onwards, we are going to no longer use the term PCOS for polycystic ovarian syndrome, and the name is moving to PMOS, polymetabolic ovarian syndrome. It's the same condition, but the reason for the name change is in part a reflection of our increasing understanding of what this condition does, and also in part to make sure that people really understand that this condition is about much more than fertility and ovulation. When we talk about this condition, polymetabolic ovarian syndrome, PMOS, in the past, in the talks that I've given, I've always stated that back then we called it PCOS, but this is a condition that is a metabolic and endocrine condition with reproductive consequences, and it is not a reproductive condition with metabolic consequences. And therefore, we really need to take a wider picture in treating this condition, and that's why the name change reminds us of this, that this is a condition that is driven by insulin resistance. This is a condition that is driven by imbalances in peripheral hormonal signaling. This is a condition that puts people at risk of metabolic syndrome, high cholesterol, risk of stroke, risk of diabetes, and risk of all of the vascular consequences that comes with diabetes and hyperinsulinemia and hyperglycemia. And in the second part, it reminds us that when we treat people with PMOS, we take a holistic view. In reproduction, as much as me being a reproductive surgeon and reproductive specialist, that's what we focus on, but really the management needs to be wider. It needs to be focus on reproductive health, focus on metabolic health, focus on mental health, focus on physical appearance and things like hirsutism and unwanted body hair, and a focus on cancer prevention. So, for example, we know that people with this condition are more likely to get endometrial cancer than not, and therefore managing and balancing hormones is about much more than just stimulating ovulation and promoting fertility. The other thing that is beneficial from this is getting rid of this idea of cis from the nomenclature, and this notion that previously if you had PCOS, you had lots of cis and these cis were somehow abnormal. And by getting rid of that, the word cystic from the name, we even don't focus on these supposed cysts, which are really follicles or eggs and which are completely normal. And we now no longer think of people with lots of follicles as definitely having PMOS. So in summary, changing their name from PCOS to PMOS means that patients ultimately get better care, because the care providers will take hopefully a holistic view on managing this condition, because the name itself reminds us that this needs to be managed holistically, and also it is a more accurate reflection of our increased understanding about what drives this condition.